Now, live from Whitney Media, 1460 WVOX, the Greenberg Report with Greenberg Town Supervisor Paul Feiner. You can join in the conversation at 914-636-0110. Now on 1460 WVOX, here's Greenberg Town Supervisor Paul Feiner.
Good morning. My name's Paul Feiner, a Greenberg Town Supervisor, and today we're going to discuss another aspect of the COVID-19 crisis, and that's how COVID-19 is impacting domestic violence. I was Googling a couple minutes ago, the issue, and there was a story one day ago on SNBC, domestic violence cases surge in mid-COVID-19 crisis. In Michigan, domestic violence cases have increased all over the country. They're increasing. So my guest today is Amy Siniscalchi of My Sister's Place. And My Sister's Place is an organization, a terrific organization that has provided help and assistance to victims of domestic violence for many years. So, Amy, thank you so much for joining us.
Thank you so much for having me.
Can you maybe tell us, am I accurate when I say that domestic violence does surge during this type of crisis?
Yeah, so what we're seeing is that because victims are more isolated than they even were before, we know that isolation is one of the tactics that abusers use to control their victims. We are not seeing so much an increase in calls or victims reaching out simply because we think that they don't have the ability to safely reach us without the abuser overhearing them or the children, let's say, that are in the home. What we are seeing and what we're hearing also from our police partners is that we are seeing an increase in the severity of the abuse. The victims that are reaching out to us are reporting more dangerous assaults that they're experiencing. The police are saying that domestic violence felonies are up by as much as 30%. And the violence that they're seeing in their responses is higher than usual.
Wow, that is terrible. So if somebody is being abused, the woman's being abused at home, and she's really afraid to call the police, what does she do? Or call My Sister's Place. What does she do?
So we are in the process of trying to establish an email address that victims will be able to reach us on. I have a friend who is in a situation who wouldn't be able to make a phone call, but she was emailing me, and I was helping her over email. So if a victim can get a quiet corner in their apartment or their house to send a message, sometimes we're hearing from victims that way. Our staff have currently an active caseload of 400 victims that they are still reaching out to and finding creative ways to do that, whether it's video, texting, messaging, to try to figure out the time of day that works for them to reach us. What we do know, though, is that we're not hearing as much from new clients, from new victims that need our help, and so we're trying to get creative now about ways that they can reach us.
In terms of the hotline number during this program, could you give out hotline numbers? Last night I posted information about this interview on a lot of social media, so some people may be listening.
Sure. So our 24-hour hotline is 1-800-298-7233. That's 1-800-298-7233, which is also the word safe for anyone that's got one of the old-timey phones. We are also accepting calls for new counseling and new legal intakes on our office lines. So for new counseling, if anyone's interested in just talking to somebody or trying to figure out their safety while they're at home and planning for that, they can reach us at 914-358-0333 at extension 201. Again, 914-358-0333. 0333, extension 201. And for new inquiries about legal services, because the courts are open to limited capacity right now for victims, we can be reached at 914-683-1333, extension 147 or 148. So 683-1333, extension 147 or 148 for any legal inquiries.
Do you find that some of the victims are nervous that their spouses or partners are going to actually be looking at their phones or emails, and is it possible to? We have to take a break, but I want to discuss whether there could be like codes where they won't know exactly what the email is saying. So we'll come back right after this break. I'm Paul Feiner, Greenberg Town Supervisor, and this is a 5-minute break.
1460 WVOX. Now back to the Greenberg Report on 1460 WVOX. Once again, here's Greenberg Town Supervisor Paul Feiner.
Hi, this is Paul Feiner, and today's radio program is probably one of the most important programs that I've had over the past 20 years or 25 years on WVOX, because we're talking about domestic violence. And the COVID-19 crisis is creating a crisis. My guest is Amy Siniscalchi of My Sister's Place. Amy, I had another question that I was going to ask before. Have you found that some people who are the victims of domestic violence might be afraid to even email because they're afraid that somebody's going to be their spouse or partner is looking at their phones or computers?
Yeah, we are very concerned about that. For the first couple of weeks of this remote working situation, where we were all trying to kind of get situated in our homes with our work phones and our work emails so that we could have the current clients that we have reach us, we started to get increasingly worried over the weeks that, as the isolation period continued, that victims would really need a way to reach us. And we are very concerned about the possibility that an abusive partner will monitor a victim's devices, their phones, their computers, their tablets. And so we are, again, we're trying to develop a quick method here of having victims be able to access an email address that doesn't give away that it's leading to My Sister's Place. So we are actually working on that. We've been working on it this week. We're hoping to roll it out next week. We do have an email address where if victims feel like it's safe, and the thing to drive home here is that every victim knows their own risks best. They know what their abuser is likely to do. They know what they're capable of doing. So some victims are able to get very resourceful and figure out either the time of day they can access us or a room they can go into. We have an email address where we can be reached. It's info@mspny.org. That's info@MSP, My Sister's Place, MSPNY.org. And if a victim is concerned about the MSPNY.org part of that email address, that is actually why we're trying to create a new address. But we would also advise victims to immediately delete their browser, clear their browsers. Our website has an Exit Now button where you can safely, quickly get out of our website with no trace that you were on it. Also, the National Domestic Violence Hotline has a website that has a chat feature, and their site is thehotline.org. So thehotline.org, and they have a chat feature if victims want to chat in real time with somebody and get some immediate help with safety.
That's so frightening. Are you, finding, what should somebody do if they're really nervous? Do they call the police or do they call My Sister's Place? And do you have accommodations for anybody if somebody wants to leave their spouse or partner?
Sure. So we always recommend that if a victim is in immediate danger, physical or sexual danger, that they do call 911. We know that our police partners, they're the frontline workers, they're essential workers, like so many, and they are actively responding now to DV calls. We've been on our own meetings and calls with our police partners to really try to strategize how we can help. They are also, though, they are down personnel. We've been seeing on the news that police are getting sick from the virus, and they're out. So their force is hurting as well. So the response times sometimes are a little down, but we do recommend that the first thing to do if you're in danger is reach out to 911. If anyone is in danger and they call us first, our only recourse will be to call 911. So to skip a step, it would be important for victims to call immediately. Now, if a victim is not in immediate danger but is really feeling desperate and wants to talk about how to safely leave right now, we do urge them to try to call our hotline or get through to us by that email or the chat functions on the national hotline so that we can begin to safety plan. And our shelter is open right now. It is operational. We've had to do a lot of learning over the last 6 weeks about how to operate an emergency shelter for victims in the age of a public health crisis. And so we are taking all the precautions necessary within shelter, helping people stay at a distance, distributing PPE and masks, and keeping folks safe. We're not filling every bed that we have just so that we can make sure that we're keeping a distance between individuals. But we are open and we do have room, so folks can reach out to us on our hotline.
How many beds are at the place?
We operate a 20-bed facility, and that is for adults or children adults of any gender or any gender identity, and children. And we house victims of domestic violence as well as human trafficking. So that is our normal bed count. Our sister agency, Hope's Door, which is also in Westchester County, has 19 beds as well. So the county has a total of 39 beds. Right now, what we are doing and what most domestic violence organizations are doing is that we are only really considering the number of rooms we have because we are not doubling up unrelated individuals in rooms like we normally would. So we have 11 rooms in our shelter. So that means we have 11 spots for individuals or families. And that's how we are trying to operate safely, weighing physical and sexual danger and those risks with public health and safety right now.
But there's probably more than like 11 people around the county who are victims of domestic violence, but they're probably afraid to reach out or whatever. Before we go on our second break, which is a little shorter than the first one, could you give us the phone number again?
Sure. The 24-hour hotline is 1-800-298-7233 or SAFE, SAFE.
Great. So we're going to have to take another break, and we're talking about making our community violence free for women who are victims of domestic violence. I'm Paul Feiner. We'll be right back.
Once again, here's Greenberg Town Supervisor Paul Feiner.
Hi, I'm Paul Feiner, and my guest today is Amy Siniscalchi of My Sister's Place, and we're talking about domestic violence. And domestic violence is rising all over the country, actually all over the world, as a result of the COVID-19 crisis. And the reason is simple, because people are locked in their homes, and people can't get out, and it's getting people, people feel more isolated. So are you finding, Amy, the abusers are, more violent than they were, before this COVID-19 crisis?
That's a little bit hard to say. It's a great question. What we know is that because we're seeing a spike in the seriousness of a lot of the assaults, that the chance of the severity going up is certainly really there. What we know about domestic violence through research is that certain factors really exacerbate the level of abuse and, in fact, what we call the lethality factor, so the risk that a victim will be killed by their abuser. And one of the things that really factors in greatly to that is when there's job loss, unemployment, usually on the part of the abuser under quote-unquote normal circumstances. But right now what we're seeing is widespread unemployment and job loss, and that could be the victims and the abusers who were supporting their families. And so that definitely adds stress to the household. And while we know that poverty and that kind of stress does not cause domestic violence, it definitely is a factor in the level of severity at times.
Right. And another, point that I think should be made is that people who are already in an abusive situation might feel that they are facing more extreme violence because in the past they would be able to escape by going to work or seeing friends, and now they're stuck in their homes.
That's right. Victims, prior to this, often, not always, but often would have pockets of their day where, maybe the children were in school, maybe they were at work, maybe the abuser was at work and they worked different shifts or things like that, where they could find a way to safely reach out to us or to safely get to the police or to the court system. And now, time has just shrunk on everybody, and there's no, often no or very little pockets of time to reach out for that kind of help. The other things that we're seeing are tactics where if an abuser was inclined to really use the kinds of power and control we see under normal circumstances, and that is really the dynamic here, that with something like an infectious disease, a pandemic like this, we see new tactics of abuse, like withholding PPE and masks, or doing things that purposely try to increase a victim's infection rate, withholding food, withholding, medical care, which are things that we sometimes see under normal circumstances, but those things get exacerbated during a public health crisis. Well,
that's it really is scary and horrible. Another thought that I thought is that in the past, if somebody was victim of domestic violence before coronavirus became a problem, they could go to the hospital or a doctor and, if they were the victim of physical abuse, and get medical care. But now if somebody is being beaten up, they might be the victim may be afraid to go to a hospital or a doctor because they're afraid of getting the virus. Is that accurate? That's absolutely accurate. I think what we're hearing on the news is that the last place you really want to be going right now is the hospital and emergency rooms. And we know that so many doctors and medical offices are doing telehealth, which obviously isn't going to be an option for a victim who's just been assaulted or something like that. What we're trying to do is think about, so we have a pretty extensive training and education program that trains nurses and medical providers, doctors, to identify the signs of abuse that may not be just physical, but also the physical signs. And we're still carrying some of those trainings out right now virtually with new hospital orientations and with nursing students at Mercy College and Montefiore and at St. John's Hospital. But what we're trying to do is get creative about, what are the few places right now where victims will actually be visibly seen, or where victims can actually convey any sort of, words or utterances to anybody in public. And so right now, what is that? That's grocery stores, that's, your Home Depots, your Walmarts, your pharmacies, places like that. And so a couple of weeks ago, we put together our flyer, and we're doing a blitz around the county of just getting that information out to these establishments so that they can be ready to give out our information if they come across somebody who is in need, and that may be the only 20, 30, 40, 60 minutes that they're out of the house. Wow, that is horrible. So if somebody is a victim of domestic violence and they want the shelter, what generally happens? Do they stay there for the rest of their lives? the courts are basically not functioning as efficiently as they were before this.
That's
so
right.
what's the future look like? And are some people saying, you know what, if I call the hotline and I go to a shelter, is this what I want to do for the rest of my, life? I might be more comfortable in my home.
Yeah, so that's a great question. So under quote-unquote normal times, folks can come to our shelter and they can stay for up to 180 days, which is 6 months. New York State Office of Children and Family Services, which licenses all domestic violence shelters in the state, has extended that and allowed us to go beyond the 180 days for anyone who's coming into shelter. What victims are doing right now, and then we provide all sorts of services to help them obtain housing for after that time period. What is happening now is that victims are weighing and measuring. When they call our hotline and they need shelter, they're weighing their options. They're not only weighing the physical and sexual violence, the risks that they're at for those things, but they're weighing and measuring coming into a congregate care facility. Because, our staff in shelter has done just an incredible job of really overnight becoming public health experts and really figuring out how to contain this situation within the shelter. We feel it is a safe place to be, but a victim has to make that choice for themselves. And right before the crisis hit, our shelter was full. And within about a week and a half, about half the beds emptied out because of people's fears of catching the virus, and kind of saying that they would take their chances back in their communities or back at home with the abuser or near the abuser rather than risk catching a virus that might risk their lives or endanger their lives. So it's a really delicate situation that each victim is kind of figuring out for themselves.
Right. When somebody goes to the shelter and let's say they don't have a checkbook or their credit card because their spouse took it away or didn't give them access to it, do they have to pay for the food and essentials? What's the typical day like for a victim?
Yeah, absolutely not. Everything we provide in shelter is free. All of their meals and snacks are provided for free. We provide transportation assistance. We have really an incredible range of staff in shelter, case managers, therapists, counselors, advocates, who will then, from the moment the victim comes in, walk the victim through during their time there in figuring out how to access benefits, how to access employment, how to stay employed if they're already employed, really how to move through the situation so that they're healing and that we're always looking at their safety. The last thing we want to do is take any of the precious resources that they have that they're going to need when they leave our facility. So we really, really do try to help them figure out how to get everything back together and get on their feet again.
Do a lot of people who are victims of domestic violence feel their life is over? And is there sort of success stories? Are there previous victims who have moved on with their lives and are totally happy? Let's talk about that right after the break. I'm Paul Feiner, Greenberg Town Supervisor. We'll be back in a couple minutes.
Now, back to the Greenberg Report on 1460 WVOX. Once again, here's Greenberg Town Supervisor Paul Feiner.
Hi, I'm Paul Feiner, and I'm the Greenberg Town Supervisor. And my guest is Amy Siniscalchi of my sister's place. And we're talking about domestic violence and the impact during the COVID-19 crisis. And again, let's start by, if you could give us the phone number, Amy. So
sure. Our 24-hour hotline is 1-800-298-7233. That's 1-800-298-7233 or SAFE.
What's the difference between the National Domestic Violence Hotline and your hotline?
So the National Domestic Violence Hotline is also a great resource for anyone to reach out to. And typically, victims who aren't aware that there's a local domestic violence hotline in their community will maybe stumble on the internet and find the national hotline. And they are a great resource for just for counseling, for folks that just need to kind of, talk through their situations, for safety planning. And the hotline also then informs the callers about the local resources in their area.
Why do people stay in abusive relationships?
That's an interesting question. It's a question that we try to turn on its head whenever we can during our outreach and our education efforts, because what it really does is it puts the sort of focus and the onus on what the victim has done to kind of maybe bring on the abuse, or what they're not doing to end the abuse. And what we know is that the abuse is entirely in the hands of the abusive party who's perpetrating it. So what we really talk about are the barriers that victims face when leaving. And so we turn it on its head in two ways. The barriers that victims face when leaving, which I'll talk about in a second, and also really, why do abusers abuse? Why do they make the choice to abuse? Because this is not just unfettered, unchecked anger. These abusers are not abusing their partners or their children or their pets, and then turning around at work, and when their boss says something they don't like, lashing out against them, or the clerk in the bank or anything like that. So these are very specific, pointed choices that abusers are making. Getting back to the barriers, though, there's a whole range of reasons, and very individualized reasons, why victims may have trouble with figuring out how they can safely leave. The very first reason that we talk about is fear. If the abuser has basically said, if you leave me, or if you try to leave me, I will find you, I will hurt you, I will kill you, I will kill your pets, I know where your family lives, I will go to them. That fear is paralyzing, and that is a level of fear that often keeps victims where they are. We know that 75% of women who are killed by their intimate partners are killed either while they're trying to leave or shortly after they leave. So those risks are very real, and they're backed by research. Other reasons would, include economics, not having enough resources, not having family support. Oftentimes victims feel like the children that are involved in the relationship really need their other parents in their lives, and leaving may feel like they're removing the children from that other parent. There may not be open shelter beds when victims need them. That is a very real possibility as well. And so there's a whole range of things. We have undocumented immigrant victims of domestic violence who are at the mercy of their abusive partner, who maybe has filed on their behalf for legal permanent residency or for status, and they feel like they can't leave because that will get taken away, or the abuser threatens to have them deported or report them to ICE. These are gripping fears. These are not, and these things have actually happened. So it's not just talk. So yeah.
Boy, it's like so scary. And what about abuse and people with disabilities? Is that a problem?
Oh, it's absolutely a problem. It's people with disabilities are at much greater risk of abuse, simply because they're really dependent in a lot of cases on others for support and for care. And if that care gets turned around or abused, we know that assistive devices or medications are withheld a lot of the times. Access to services is withheld. Language access is a problem. So if somebody is deaf or hard of hearing and can only communicate with folks through sign language or through video or through chat, and the abuser, withholds those functions, you can just imagine that the landscape is ripe for abuse. In addition, folks who are disabled are at greater risk for sexual violence as well, and physical violence, because they often aren't able to access the resources or to really fight back in any way.
Another issue that comes up is women who are pregnant and being the victims of abuse.
That's right. Pregnancy is absolutely an increased time for abuse. Oftentimes it's thought that because it becomes another sort of thing that the victim cares about, that the abuser can threaten the victim during pregnancy or cause serious injury or harm, maybe even causing the victim to lose the fetus, to lose the child. It's also one of the factors that we know, backed by research, that if a victim is abused during pregnancy, her risk of dying at the hands of the abuser goes way up as well at a subsequent time. So,
we have a phone call. Good morning. I'm Feiner. Hello?
Hello?
Hi, you're on the air.
Yeah, I can hardly hear you. I hope you can hear me.
We could hear you.
I thought there was some sort of a law that said if someone who is undocumented claims to be a victim of abuse, that they can more quickly get a green card or something to help them get a job. Is that true?
Yeah, that's a great question. So yeah, there are pathways to legal status, to obtaining legal status, if you have been victimized, or if you've been victimized within the context of an intimate partner relationship, but also if you've if you've had a crime committed against you and you are cooperating with law enforcement, there are other remedies as well. So the main problem we see with that is victims who don't know that those remedies exist. So we have a pretty extensive immigration legal department that really does a lot of outreach and provides that direct legal support and representation to try to get the word out to the undocumented immigrant community that we are here and that we can walk them through their options. And those services are free as well.
Thank you. We just have maybe a minute left. Could you tell us, I just want to mention how impressed I am with your passion and, dedication to this cause and to My Sister's Place, and want to mention that, I think that the community and the county is very lucky to have somebody like you who is so dedicated.
Thank you so much, Paul.
What made you get involved with, My Sister's Place, and what do you think about, how does it feel to work for such an important organization?
Well, I've been doing the work of anti-domestic violence, human trafficking, child abuse for over 20 years, and I've worked at a range of agencies. But I think the best testimonial to why I'm at My Sister's Place is sort of that I had worked at My Sister's Place for 11 years, and I went and worked elsewhere for 5 years, and I've been back at the agency since last September, because there's just nowhere like My Sister's Place. The level of dedication of the staff, our CEO, her passion, our board of directors, our volunteers, it inspires me every single day. There's so much hope in these issues, in spite of how dark and difficult it can seem. And we do see, you had asked earlier before the break, if we see victims and survivors coming out on the other end of this, and that's why we do this, because we see that every day. We see small steps and we see big steps, and we do see victims getting to safety and really getting back on track with their lives and their children's lives. And so that's why I do this work. I think the injustices abound. We do a lot of anti-oppression work as well, and that really excites me and keeps me motivated to do this work.
Well, it's really great. I'm so thrilled that I had the opportunity to interview you today, and want to wish you best of luck, and I'll do whatever I can to help publicize the great work that your organization does. My Sister's Place really is an amazing organization. I'm Paul Feiner.
Thank you so much, Paul.
Thank you.